Good evening, guys. Tonight's discussion C, we're discussing home care versus home health care. Now there's a difference, so I'm going to go through those differences for you. And like always, it's an open-ended chat, a live chat. So questions, comments, you can ask them during the show or after. The live chat will be up after when I finish the show, it'll be up also. So let's have a chat about that. Here we go. Here's a clear, grounded explanation of the phrase home care versus home health care, based primarily on the content of the page you're viewing. Okay. What the page is getting at. The video on your page features a conversation between Jeffrey Snyder, Broadcast Retirement Network, and Liz Siegert, American Association of Healthcare Journalists. Their discussion centers on a simple but important distinction. Home care and home health care are not the same thing. And understanding the difference determines who pays, what services are available, and which professionals are involved. The page doesn't give a written background breakdown, but the context of the interview makes the contrast clear. The core distinction: home care, non-medical support that helps someone live safely and comfortably at home, typically includes help with bathing, dressing, grooming, meal prep, and light housekeeping. Companionship, transportation, safety, supervision. Who provides it? Care aides or professional care attendants. Personal care attendants. Trained in daily support, sometimes with specialized experience, e.g., dementia care, but not medical clinicians. Who pays? Usually private pay, long-term care insurance, or someone's Medicaid waiver programs. Medicare does not cover standard home care. Home health care: clinical, medically necessary services delivered at home under a doctor's direction. Typical examples include skilled nursing, physical, occupational, or speech therapy, wound care, medication management, post-hospital recovery support. who pays, who provides it, licensed clinicians, RNs, LPNs, therapists, medical social workers, who pays. Often Medicare, Medicaid, or private insurance, but only when the care meets medical necessity criteria. Why the distinction matters. The interview on the page emphasizes that families often confuse the two, which leads to misunderstandings about coverage, surprise out-of-pocket costs, difficulty planning long-term support, mismatched experience, mismatched expectations about what caregivers can legally do. The conversation is especially a public facing explainer home care equals daily living support. Home health care, clinical treatment at home. And giving, if you want, we can go deeper. Given your ongoing work around caregiving, transitions, and family-centered frameworks, I can help you turn this into podcast segment online, caregiver-friendly handouts, comparison chart for workshops, messaging tailored to Pennsylvania or other communities. What the page is doing. The article is straightforward, caregiver-focused guide designed to clear up a very common confusion. Home health care and home care sound alike, but they serve different purposes, involve different professionals, and are paid for in different ways. The page walks readers through what each service includes, who provides it, when each is appropriate, how they often work together, a comparison chart to make the difference obvious. It's written to help families make confident, cost-aware decisions. Home health care, medical, prescribed, clinical. The page emphasizes that home health care is medical care delivered at home and requires a doctor's order. It's meant for older adults recovering from illness, surgery, or managing unstable health conditions. What it includes from the page: physical, occupational, or speech therapy at home, monitoring serious illness or unstable health, pain management, injections, wound care, pressure sores, surgical wounds, IV or nutrition therapy. Who provides it? Nurses. Physical, occupational, and speech therapists. Other licensed clinicians. Why it matters. It's often covered by Medicare when prescribed and can be as effective as hospital or skilled nursing facility care for certain conditions. Home care and home care. Non-medical daily living supports. The article contrasts this with in-home care, which is non-medical and focused on helping older adults stay safe, comfortable, and supported in their daily routines. What it includes from the page: bathing, dressing, grooming, medication reminders, help moving around or transferring, meal preparation, light housekeeping, dishes, laundry, vacuuming, companionship and social connection. Who provides it? Caregivers or home care aides. No medical license required. Why it matters. It supports independence, reduces caregiver strain, and fills the gaps that medical care doesn't cover. How the page explains they work together. The article gives concrete examples of how both services often overlap to support recovery and safety. Medication. Home care reminds the older adult to take meds. Home health. Nurse adjusts or manages medications. Physical therapy. Home health therapist teaches exercise. Home care giver encourages daily practice, ensures safety, reports concerns. The pairing is especially common after hospitalization or major health events. The page's comparison charts summarized. The chart highlights the core differences: home health care and home care. Okay, guys, here's what the difference is for both. Must be prescribed by a doctor. That is home health care. Covered by Medicare when prescribed. Skilled nursing, wound care, injections or IVs. Therapy visits at home can change, adjust medications, That's home health care. Okay, here we go with home personal care aids. No prescription needed. Usually private pay. Companion meal prep, housekeeping, help with grooming, hygiene, mobility. Provides reminders only. The page's overall message. The article, the article's closing message is that understanding the difference empowers families. Choosing the right mix of services can improve safety, support independence, reduce stress for caregivers, strengthen the overall care team, preserve dignity and quality of life. It frames the decision not as stepping back, but as strategically expanding support. Okay, guys. That is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.